And they asked Kamala Harris about abortion, and she got off on this tangent saying that in states where abortion may be restricted, maybe as to gestational age or not at all, that women can't get care for miscarriages and can't get care for ectopic pregnancies. Well, that's a flat out lie.
3, 2, 1.
Hey guys, welcome to VTT TV Global Prophetic News. Tim and Donna Avery here.
Welcome.
Hey, we have a special guest today talking about abortion again today. We have a OBGYN, Dr. Mike Watkins. He's been in the practice for a long time, and I'll have him share a little bit about who he is. So we're excited to bring him on to share about some of the things that has been going on in the news, because I know there's talk going back and forth about the laws of abortion and across our nation. What is late-term, third trimester abortions and all that stuff. So we'll cover a lot of things about abortion in this conversation. So.
Yeah. And as you guys know, with Visual Testaments, with VTTV, the mission is that we bring hope to the hopeless and point the father to the fatherless, the fatherless to the father. And so we want to make sure that you guys understand, this is one of the passions of our heart, is that people understand the true definition of what abortion actually is, and also what it is not, and what it covers, and more importantly, why pro-life, because I think there's been a lot of negative connotations put to pro-life, which sounds crazy when you just think about it. It's not our choice. It's that we have a choice and we have free will. So if you're going to call pro-choice, it's actually I'm pro-free will of my own will. And so I really want to be able to uncover
and dispel some rumors and lies and misunderstandings.
Right. I really
get a first point of view from an action OBGYN.
I really want to be able to uncover exactly what the terms are. And when you understand what's actually happening in the background, so that the goal is that you want a goal in how you handle your reproductive rights, then listen to what actually happens and then determine, if I'm calling this the correct term, because you may actually be pro-choice, but you think you're pro-choice, but you're actually, what your goal wanting is actually pointing to pro-life. And so, a lot of times when you take a test, for example, when we took our real estate test, we felt like things were flipped backwards, and we were like, it's kind of like a negative question and a different way to answer. And so I want to be able to really have you think about the question that you're ultimately trying to answer is, do I want pro-choice or pro-life? So let's hear from Dr. Mike Watkins, who has over 40 years of experience in OBGYN. So hi, Dr. Mike Watkins.
Hey, how are y'all?
Doing good.
Great.
With us,
Well,
thank you for the time.
Let me give you a little background. I've been practicing for 41 years now. I started medical school in 1975. That's just 2 years after Roe versus Wade in 1973. So this impacted me greatly. Going into OBGYN at that time, when I started looking for a residency in OBGYN, many residencies did abortions and actually ran abortion clinics. And to be pro-life at that time and try to get a position in obstetrics and gynecology, many programs would tell you, we're just not interested. If you're not interested in doing abortions, you're not going to come here. And that was more than a couple of places. And that still happens. Wow. They won't come out and tell you that, but they will find out where you stand.
Wow.
Because it has become a dominant issue in obstetrics and gynecology. But I assure you, I know pretty much what there is about abortions, how they're performed. You ask the question, I'll be happy to.
Well, let me ask this, since you're talking about like residencies and OBGYNs as they going through residency and things like that and choosing that as their profession for their medical career. you made a statement that like they're now asking if you're opposed to doing abortions, that you may not want to go down this route. Now, is that something that is now maybe being enforced, that they have to do abortions now as an OBGYN, or is that something?
No, no one can force you to do them. And they won't come right out and ask you if you're pro-life.
Okay.
When you have an interview, you're going to interview with several faculty members. You may interview with 2 or 3 residents in the program. And that's where they find out. You'll just be going around looking at the hospital, talking with the residents, and they'll probably sound you out. Okay. And if they find out you're not going to do abortions, that keeps it under the table so they can deny that they will not take a resident who's pro-life.
Gotcha.
Because that would be against the law.
Yeah, it would be.
So they find out other ways.
Gotcha.
And that's still probably the case. Most are pushed that way. The reason I stayed pro-life was my wife. She kept me from basically being pushed that way and drinking the Kool-Aid, so to speak.
Gotcha. Now, since this has been such a hot topic now, especially with this past debate between the 2 candidates for presidency, there was a point in that debate where one of the moderators, Lindsay Davis, in fact tried to fact check Donald Trump on that there are no late-term abortions, or there's no after-term abortions, like after someone has been born, that they are unable to do abortion. You fact-checked them on that. Now, and I know there's different state legislatures that have different varyings of abortions, but can you talk a little bit about that? Because I know you're kind of in the know of all those things about the different state legislatures for abortion. What would you say to that he was fact-checked on that? And, are there any states that still have third trimester abortions, or after birth? I wouldn't call it abortion, but, the killing of an innocent baby afterwards.
Well, in no state is it legal to kill the baby after it's born.
Okay.
What Trump was referring to is one of the state governors came out and said they did late-term abortions in his state. And part of the problem with late-term abortions, it matters how you do it. If you give them medicine to make them labor and deliver a baby, they might well deliver that baby alive. And if it's late term, what they do, and that's the thing they can't stand, they cannot handle a live baby after an abortion. Babies born alive, they just put it aside and don't care for it and let it die.
Wow.
But there are a number of states that allow abortions all the way up to term.
Yeah.
In fact, I just read a story today. Somebody, I think, from Students for Life called a late-term abortion clinic in Maryland and told them she was 34 weeks gestation, which is 6 weeks from her due date, where babies, virtually 95% of them would survive if they're born at that point. But she called and said, my boyfriend's left me. She gave him the big sob story and told him she wanted an abortion. And they said, sure. And they told her how they would do it and what their process was. And this is how George Tiller did it back when in Kansas City. They would ultrasound the baby, put a needle into the sac where baby is, and they actually told her they would inject lidocaine into the baby so baby didn't feel any pain. And then they would proceed to put a needle into the baby's heart and inject it with drugs to kill it. At that point, you can't change your mind because the baby's already died. And then they give you medicine to put you in labor and go on with the abortion procedure. And they told her it would be a 3 to 5 day deal. There are different ways to do it late. Like I said, the easiest way, and the way that always bothers me, you would think when they say it's totally safe and they talk about dilating the cervix and reaching up and basically dismembering the baby to take it out, which is what's called a dilatation and extraction. You would think that if that's the safest way to go about doing it, that if I had a dead baby come in at the same gestational age, if that was the safest way to do it, you would expect I would do it that way because it was safest for mom.
Yeah.
Well, we never do it that way with a dead baby. We always give her medicine to put her into labor and deliver the baby. Just like an induction of labor, we use a little different medication. The problem with that when you're doing an abortion, it doesn't always kill the baby. And that's why if you do it that way late term, you're going to have some babies born alive. And that's just the worst thing for an abortionist, to have a baby born alive. That's what Trump was talking about. These babies, and they had a case of 5 of them. And I don't know if it was in Minnesota or exactly what state, but they left these babies out on a side table to die without doing anything for them.
Yeah. Go ahead. You got a question?
I think 2 questions. You said George Tiller. For those who don't know who that is back in the day, if you could explain that. And number 2, if you could also explain, so if I am a pregnant mother right now and I'm listening to you, but I have been pro-choice most of my life, and now I'm all of a sudden finding myself pregnant, but I have heard that I don't have options
around funds to take care of it.
You know, and that because I live in a abortion banned state, so to speak, what would you say to that pregnant mother?
Well, I would say this. They tried to say on the debate that Trump would ban abortions across the whole country. And that was never his plan. His plan, and the Supreme Court did it by overturning Roe versus Wade. They returned the whole question to the states, which is where it was before Roe versus Wade. Each state made up their own laws that way. That way, the actual people of the state have a say-so.
Yes.
And if a state absolutely bans abortion, that's because the people in the state wanted it that way.
Yep.
Okay. So abortion bans, being pro-life, and one of the reasons I'm pro-life, I've taken care of delivering babies, and I still do, but I do ultrasounds virtually every time I practice. And we ultrasound babies down to 6 weeks. And it's 6 weeks of gestation. And we count gestation from when the last period was, not from when conception took place.
That's a good
If you're
point.
talking conception, we ultrasound babies at 4 weeks of conception and find a heartbeat.
Which
That's literally 2 weeks after mother has missed her period.
Right. Okay.
And by 8 to 10 weeks, we see a baby with limbs. We sometimes see movement. It's developing rapidly. It looks like a baby. All this garbage they said in the past, it looks like a fish. That's hogwash. It looks like what it is, a baby. And by 12 weeks, you see it waving its arms and moving around. That's early in pregnancy. So I can't see doing an abortion on a baby. And there's no question it's a baby, and it's a human baby. It's not a blob of tissue. By the time we can see it, it's not a blob of tissue. So they have said so many lies that people have just sucked right in and taken as the gospel. But the truth of the matter is, it's a human baby from the moment it's conceived.
Yeah.
When dad's DNA gets together with mom's eggs and it's fertilized and starts growing and reproducing those cells. And it's a wonderful process. The eggs, the cells know what to do.
Yeah.
That goes from one cell egg to multiple cells, and those cells know what to form. We can't understand exactly how those cells know exactly what to do. And they know that they're going to form a spinal cord, or they're going to form a heart or a brain or whatever. It's amazing.
Yeah.
It's a miracle every time it happens.
That's incredible. Yeah.
The other thing I want to say is they asked Kamala Harris about abortion, and she got off on this tangent saying that in states where abortion may be restricted, maybe as to gestational age or not at all, that women can't get care for miscarriages and can't get care for ectopic pregnancies. Well, that's a flat out lie. I have reviewed, one of the representatives here in South Carolina asked me to review the pro-life law they were putting up. And all the pro-life laws that restrict abortion have written exceptions for miscarriages and ectopic pregnancies.
Wow.
And basically a miscarriage, the pregnancy has already died. It's not developing normally, and the patient's bleeding and cramping to pass that pregnancy so she can go on and have other babies in the future. And a tubal pregnancy or ectopic means the pregnancy has implanted in the wrong spot. Wow. The egg comes from the ovary and travels down the fallopian tube, and if it's fertilized, it implants in the uterus. Well, sometimes that egg gets fertilized in the tube and implants in the tube, and it can only grow to a certain point before it ruptures the tube like a balloon busting.
Yes.
And they bleed inside, and
yes.
It can be catastrophic. People die from it. Yes. I have seen people close to death.
Yes.
That is an emergency, and
yes.
There's never been a restriction on that.
Yes.
So she just lied to stoke fear in the pro-choice people. Okay.
So the truth is that there's no bans when it comes to if somebody needs care for ectopic pregnancy or miscarriage, because they typically, like you said, that they probably won't go to an abortion clinic. They come to the emergency room to get taken care of that, right?
Right. That's another issue. And thing they never talk about is these abortion clinics and people that do abortions, they don't take care of their problems. If they do a simple little suction abortion where they scrape out the womb and scrape out the pregnancy, if they have a complication, they don't take care of it. They send it to the emergency room. If they give you medication to make you abort or miscarry at an early stage, and you only pass part of the pregnancy and you're bleeding and cramping, you don't go back to the abortionist. Me and people like me take care of you. You come to the emergency room and I get called. And I assure you, I have been called. I see reports all the time in Life News about abortion clinics doing later term abortions. And those do have significant risk to them because the uterus is very large and the baby's very large. And it is easy to poke a hole in the uterus or do other damage. And the abortionist doesn't take care of it. He sends them straight to the emergency room.
Wow.
Yeah.
And I have heard horrific tales. I won't say lucky enough, but during my residency, one time we had a patient, and this was many years ago, before we had excellent ultrasound, before we did a lot of procedures. This woman came in and we didn't know if she had a tubal pregnancy or a regular pregnancy, but she was bleeding. She had a lot of pain and we thought she might have an ectopic pregnancy. But she didn't want the pregnancy in any case. And so my faculty member said, why don't you put a laparoscope in her belly and look and see if there's an ectopic pregnancy? If there is, we'll operate and take care of it. If you don't see one, I'm going to do a DNC and terminate the pregnancy. And he said, why don't you just keep the scope in and watch as I do it from above, which never happens. I've never seen it before or since, but she did not have a tubal pregnancy, and he did do the abortion. And I watched from above, and that suction catheter, every time he put it in and turned it around, I could see it indenting the uterus. The uterus is not, when it's pregnant, it's soft and very friable.
Yes.
And I could see exactly where that suction curette was. It was eye-opening for me. I assure you, after that, if I did a miscarriage and put a suction curette in, I was very careful because I saw how easy it would be to poke a hole in the uterus.
Wow.
I know of a young doctor back when I was in training, and one of the very first miscarriages he took care of after he joined a practice, he put the suction catheter in and was moving it around and suctioning out the parts of the pregnancy. And he perforated the uterus. And that suction catheter grabbed the bowel and sucked out about 1.5 feet of small bowel into that suction catheter.
Wow.
You know, and that does happen. That's a known complication. So these things are not without risk.
So when you say that, Dr. Mike, when you say that, you know, and I do want to, can you, before I ask this question, can you briefly explain George Tiller for those who don't know? Because I keep hearing that question come up.
George Tiller was a notorious late-term abortionist. And I don't remember exactly. I think it was Kansas City. It was somewhere in the Midwest. And I read about him when he became notorious. And his method was the patient came into his office, just like this late-term Maryland clinic did. He ultrasounded the patient. And the first thing he did, you want an abortion, that's fine. Took a long needle, went through the abdomen into baby's heart and injected medicine and killed the baby on the spot. At that point, the mother has no choice in the matter. The baby's already dead. And then he would inject medicine into the uterus to make her go into labor and expel the pregnancy. But that was the way he did it. And it might take 24 hours, but they would go into labor like normal labor and cramp and bleed and pass the pregnancy. But he was notorious for doing that. He was one of the first that they publicized.
Wow.
Wow.
So going back to the question then, when you say that you saw that catheter suction, even the uterine walls, you know, for that newly pregnant mom that's going in there, or woman that's going in there and may not see herself as a mother yet, that risk, what does it look like, even if she plans to go through with the abortion? What does it look like if her uterus is punctured?
Well, the uterus is a muscle, and if it is a small hole, it usually will heal itself. The muscle clamps down and closes the hole. Now, it may not be. It may do some damage based on where the hole is. To the sides of the uterus are where the vessels are, the blood vessels that supply blood. And if you puncture one of those, it's an emergency. But if you just puncture the top or the back wall of the uterus, it likely might heal itself. But generally nowadays, we would put a laparoscope. We'd put her to sleep, put a laparoscope in, and look and see if there was something we needed to do to repair it, or if it done any damage to other internal organs.
Well, you say nowadays, but that's considering that you are a doctor with integrity. So going to abortionists who just want money, and every patient is a number that you've got to get out of the time clock so that you can turn tables, so to speak. When you are thinking from a money greed mindset, which I don't care how sweet they are to you, honey, if you're calling and they're wanting to take your baby and help you with that, they're not sweet. So when you're going into an abortionist clinic who now is trying to flip tables and get you in and out and get about 100 patients in, like when you are working against the clock, is that necessarily the case where they're actually going to put what'd you say?
A laparoscope.
Oh, they can't do that in an abortion clinic. That has to be done in a hospital in either an outpatient surgical setting or in the hospital in the main operating room. That's not something he can do. That's why when they have a complication, that if they are forced to, they're going to send them to the hospital.
Wow.
And if they're doing anything illegal, then they're likely not. There's a possibility that they might not send them to the hospital, which then puts the patient in danger.
Well, the problem is occasionally they might not know they've done it.
Yeah.
Right.
It becomes readily obvious. And they certainly do abortion sometimes and don't get all of the pregnancy. And they leave some behind. And then it either causes an infection or they continue bleeding. And again, they go to the emergency room and they call me, and I have to repeat the procedure to get all of the pregnancy out. And I've done that a number of times.
Yeah.
So
well, let me ask this too, because I think, this is the one of the other remaining arguments that, somebody who was pro-choice would have, which is, well, what about having the exception for someone who is raped or incest, or has an incest situation where they want to terminate the pregnancy because of those reasons? What about those? Would you consider those emergency situations, or are there alternatives that we could, implement if we do have a nationwide abortion ban?
Well, I'll start off by saying those are very rare. They would like you to think they happen commonly, but if you know anything about biology, there's only a small window in a woman's cycle when she's actually able to get pregnant. And to say that she had intercourse by rape or incest or something right at that time and gets pregnant, that would be rare. Just statistically, that would be a rare event. But even if it does happen, and it's horrible, and I grieve for that mom. However, that baby is still innocent. That baby is still alive and growing inside her, and that baby didn't cause that problem. I would say, and I would tell them, I don't do abortions at all, and I wouldn't do it for that. But if she insisted, I would tell her where she could get it done. But I would also tell her the other side of that is there are lots of people out there that want a baby desperately and for reasons can't get pregnant. Maybe the woman had a hysterectomy at a young age for some reason, or some other kind of problem that keeps her from getting pregnant. Those babies are wanted. Yeah. We adopted a child. I was 45 years old. We had several adoptions fall through. And then they called us and we told them it didn't matter. We wanted a baby. We adopted a black child and he's a wonderful person. He's 26 years old now. And I wouldn't do anything different. Yeah. You will make a couple exceedingly happy by giving up your baby if you don't want it. I've also heard stories of people who didn't have abortions because of rape causing a pregnancy and telling stories how it was wonderful and the child became this wonderful person or was adopted out. Yeah. There are two sides to everything. And I agree, it's a travesty when that happens, but let's face it, baby's not guilty of anything, and destroying a baby is not the way to go.
Yeah. I think that's
giving her support and helping her through the pregnancy and even afterwards is the way to go. And that's the church's place.
Correct.
Absolutely. And I think that's very 2 points I want to make about that too, Dr. Mike. One is, you've clearly illustrated in such a beautiful way that, God makes says in his word, he makes beauty out of ashes. And, you know, in such a tragedy like that, you know, of a rape or incest case, you know, there are other alternatives to, like you said, adoption. You know, there's, you know, and I think that's beautiful because you said this already, that, you know, it's clear that there are people who desperately want a child who can't have a baby, you know, and I think that that's beautiful to be able to make that situation into a better situation because, you know, because like you said, it's not the baby's fault. It's very innocent when that does happen. And the other part of that is too, is like you said, it's the church's place to kind of help in situations like that, you know, to provide programs for young moms, you know, because I think sometimes the statistics show that it's typically young moms who feel like they can't take care of a baby. And so they feel like their only option is to abort. And or, you know, or somebody wasn't ready to have a baby. And so their plan is to abort. And I think or they're in a situation where they can't feel like they can't just take care of it. And I think that's a place for the church to kind of help step into a place where if they have programs set aside, that the church can have, you know, different programs for young moms or some type of adoption program or a place where they can introduce different programs that would help an adoption process of some sort. Yeah, I think that's great.
Yeah, and to that note, I want to point out too that the church is not just a church building. The church is also is capital C. This is the church, the people, and I just want to point that out because I feel like there's a lot of even marketplace leaders who also put their opportunity out there for backing adoption. Mm-hmm. And so we do know that there's even some places that we've you know, some people that we've met that are marketplace leaders and church, and they've really made it a point to put a backing financially, put connection to the money. If it's a money issue, if it's a financial issue, and you just have a hard time seeing how you're going to adopt a child or how you can give it up for adoption and go through with supporting. So I just want to point that out because there are people out there with the church involved where they are actually making programs to where they will back this. Yeah. You just got to say yes and have faith that that's going to work out. And so that's a huge step. I appreciate you bringing that up, Dr. Mike, because I think that a lot of times when you're newly pregnant and if there's fear, if a door has been opened to where they're fearful, then all of a sudden it looks like there are no options. There's only an option, and that option is to get rid of it. Yeah. Notice I didn't say abort. I think I hear all too often when I had friends in these situations and those terms were coming up, really what they were saying is, I just need to get rid of this. This thing just needs to go away. I am panicked. This is an issue. And so to get rid of it, to pull back that curtain and say, well, what does it look like to get rid of this situation right now? It doesn't have to look like abortion. It can look like adoption. It can look like other options. So I'm so thankful that you bring that up.
And there's
the other thing to bring up is pro-life pregnancy centers. Yeah. And they do support people like that. I read ultrasounds for them, and they provide ultrasounds for moms. And what I've found in my practice, it got me in trouble one time because I told young doctors I was training, I said, my practice is the first time a woman comes in with a pregnancy, I put the ultrasound on her and show her the baby. And if she's far enough along, she sees this moving baby with arms and legs and a heartbeat and sees this baby, she's much less likely to abort it. Yeah. And pro-life centers do that. Plus, they provide for the mom. They teach them. They help them learn how to take care of a baby. They provide them with things for a baby, diapers, wipes, all kinds of things. And they mentor these young ladies and give them good information. So they're a wealth of information, and they're there to help these moms. And I assure you they do.
And we'll put some of those links in the description below. We'll try to put in one for every state about a pregnancy center that if you're watching this and you're a young mom and you're in that situation where you're trying to decide if you're going to abort, if you want to have your baby or go to term, we'll put in the links below, just some pregnancy centers across the nation that you can maybe reach out to. So,
well, I would like to ask, if you're watching this and you know a pregnancy center in your state, please comment, put it in the comments so that we make sure we have it. We may not be able to get every single one, but if you're in a state other than South Carolina, please put it in the comments what state you're in and what pregnancy centers are available to help these new moms, because that's a great option. And I really appreciate that, Dr. Mike. And as we close out, like what final words would you like to leave? Because I really believe what I hear you've laid out is that the abortion ban, so to speak, is not really, truthfully is not being defined correctly. And I really believe that I hear you say we have to clarify that what an abortion ban actually bans and what is the exceptions. Yeah. And so is there anything you would like to clarify on any of that as we close out and reiterate? Because I think it needs to be said and probably overly communicated.
Right. Well, I will say this. Being pro-life, I've seen the laws and read about them. Every state is different. Some states put a ban at a certain gestational age and say it can't be done after this point. Some ban it entirely once they can see a fetus with a heartbeat. That's called the heartbeat law. If you can see a heartbeat on ultrasound, you can't do it. So find out what your state does. But remember this, each state is different and each state's laws are made because that's what the people in that state want. And that's what democracy is. It's not having some federal government tell you everything you can and can't do and either establishing a total ban or the federal government coming down and tell it's a free-for-all. You can do it whenever you want. No state is doing killing babies after they're born, except after an abortion. If it's born alive, they will leave it out and let it die. But it has been discussed greatly. And there are a lot of people that would be up for, and it has been discussed, being able to kill the baby up until a week after it's born. So don't think that because it's not legal now, it won't necessarily become legal in certain states in the future.
Yeah.
You know, it was when I started out in OBGYN, it was unthinkable to do a late-term abortion. I mean, I remember the mantra was safe, early, and legal. Okay. That's not so anymore. They want to push the boundaries and be able to do whatever they want to do. So things have changed so much, they might change more because people are pushing the boundaries.
Wow. Well, thank you, Dr. Mike, for coming on and just sharing your insight, being an OBGYN and in the practice for over 4 decades. Appreciate you sharing your wisdom on this. And so thank you for your time. I know you got to get going with other things, but you have anything else we want to share?
Well, I just want to point out for those of you who please like and share and subscribe to this channel. We also have on visualtestaments.com merch specifically to the pro-life movement. We have hoodies specifically for this pro-life movement. And so as a result, of course, 100% of the proceeds go to the very VT mission that we're discussing here. So I want you to go check that out on visualtestaments.com. I thank Dr. Mike again, Dr. Michael Watkins, over 4 decades of wisdom, hands-on experience in knowing what he's talking about, especially even from the state standpoint and what is banned and what is not, and what is accepted and what is not. And so, you know, really being able to determine truth and go to the Lord and ask, you know, even whether you're a believer or not, what does it hurt to say, God, if you're out there, tell me that, is this your child you want me to keep? You know, and then trust him, because if he tells you I'm proof, he will provide. He will. When you trust him, he will make a way and make an exceptional blessing out of what he's doing. So I just want you to hear those words and how important that is to go to the Father.
Amen. Well, thank you guys for tuning in, and catch us on the next one. We'll see you guys. Bye for now.